There are lots of folks who show up in Tennessee's emergency rooms without health insurance. Some of them are illegal immigrants, and some of those immigrants are covered by TennCare. So your tax dollars are paying the bills. Dagny Stewart has our story.
Can you tell just by looking which of these Spanish-speaking construction workers are in this country legally or perhaps illegally? Neither can workers at Tennessee's hospital emergency rooms. But when immigrants need health care, even if they're here illegally, hospital emergency rooms must treat them, and some of your tax dollars are paying for that treatment. In the past year, Vanderbilt Medical Center has seen a 17% increase in the number of undocumented individuals at their ER.
120 of this year's undocumented patients have been deemed illegal immigrants by DHS and have been granted TennCare coverage.
Parizzo was one of the hospital executives who testified today before Tennessee Congressman Marsha Blackburn and Georgia Representative Nathan Deal. Some state lawmakers maintain illegal immigration is now a state issue.
I too submit to you that every state is a border state, but additionally, every town is a border town.
One of those border issues is TennCare. In July alone, TennCare reimbursed hospitals for 62 illegal immigrants, and the cost to Tennessee taxpayers was $1.7 million. Much of the TennCare money is for mothers and babies.
That child, when born, is a U.S. citizen and is entitled to 12 months of Medicaid eligibility coverage from that point forward.
Protesters outside today's congressional subcommittee hearing claim this was just election year politicking. This Vanderbilt professor researches demographic patterns.
Undocumented migrants are very unlikely to use any health services in the United States. In fact, they're more likely to, if they're sick, return back, especially if they're Mexican.
But after hearing from hospital and healthcare executives, Congressman Blackburn maintained illegal immigration may be one of the factors contributing to everyone's rising healthcare and insurance bills.
We see that your charity care increases every single year, and somebody is going to pay the bill, and it is many times going to be those private pay. So I would say that this refutes that argument that there is no problem.
Now, TennCare officials pointed out that they have a $7 billion budget, and the money used for illegal immigrants is just a tiny fraction of that budget. But State Representative Bill Ketron maintains that TennCare cut nearly 300,000 people from its rolls, many of whom have lived in Tennessee all their lives. And he says it's not fair for people who are here illegally to get coverage that legal residents can't get. Dan?
Dagny Stewart tonight. Thank you. Next week, the congressional subcommittee will hold another hearing on the effects of illegal immigration on health care costs. That hearing will be in Dalton, Georgia.